In this video, I'm going to walk you through the external anatomy of the skull in different views, and I start with the frontal bone, which is this very large bone that forms the front of the scalp, a forehead, and also the roof of the orbits. And if I look at the lateral view, I can see that frontal bone also forms a very small section of the lateral part of the cranial region. This is the bone that forms a suture named coronal suture with the two parietal bones. And I can see that aside from articulating with parietal bones, it also articulates with sphenoid bone. That's the greater wing of the sphenoid bone. It articulates with zygomatic bone, which is one of the facial bones. When I go inside the orbit, again, I see that frontal bone articulate with, for example, both zygomatic bone and sphenoid bone. What I'm pointing at is the greater wing of the sphenoid bone, and deep inside the orbit I can see the lesser wing of the sphenoid bone. And then in the medial wall I see that frontal bone articulate with ethmoid bone, which is one of the cranial bones, and in front of ethmoid bone I have one of the facial bones named lacrimal bone. When from lacrimal bone I move anteriorly, I have a section of the maxillary bone, and then finally here I get to the nasal bone. So this is the bone that articulates with several cranial and facial bones. Exactly where I'm pointing at, deep inside the frontal bone, we should look for the two frontal sinuses. They are air-filled cavities lined by ciliated pseudostratified columnar epithelium, which contains goblet cells, and we know goblet cells secrete mucus. Mucus from frontal sinuses will be emptied into frontal ducts, and when we follow the frontal ducts, we see they open inside the nasal cavities exactly in middle nasal meatuses, the grooves that we have below the middle nasal conchae. Recall, middle nasal conchae are part of ethmoid bone. Secretion of mucus from frontal sinuses and some other paranasal sinuses that we have inside the nasal cavity assist the nasal cavities to do the conditioning of the air, which we know in general mucus is sticky. It can trap debris, particles, clean the air, and also mucus contain water. Adding water to the air make air moist and reduces friction. This sharp edge that we have here is called supraorbital margin or supraorbital ridge. When I follow supraorbital margin and move toward the midline, here I can find this indentation, which is very small. And please note that we have this indentation on both sides. We name this supraorbital notch. Clearly, the nerve that passes through supraorbital notch would be referred to as supraorbital nerve. Supraorbital nerve is one of the branches of ophthalmic nerve, and we know ophthalmic nerve is one of the three main branches of trigeminal nerve, cranial nerve number 5. Also, the blood vessels that pass through the supraorbital notch would be referred to as supraorbital blood vessels. In some skulls, instead of notch, a depression, we actually have a hole, we have an opening. If that's the case, we refer to that as supraorbital foramen. Now, from frontal bone, I start moving down and analyzing some of these facial bones that we have here. I start with the two nasal bones. We see that the nasal bones articulate superiorly with frontal bone in a suture that is referred to as frontonasal suture, and each nasal bone laterally articulate with part of the maxillary bone. We name this part of maxillary bone frontal process of the maxillary bone because this part articulate with the frontal bone. Speaking of the nasal bones and maxillary bones, as you can see, they basically form the superior part of the nose, the bridge of the nose, and also the lateral side of the nose. Please keep in mind that maxillary bones, aside from forming the lateral wall of the nose, also they form the anterior portion of the hard palate, which hard palate would be the floor of the nasal cavities. In each maxillary bone, we should identify 4 projections. One would be the frontal process, The other one would be this projection that we refer to it as zygomatic process of the maxillary bone because it articulates with the bone zygomatic. The next process is the alveolar process of the maxillary bone. This is the part of the maxillary bone that contains the alveolar sockets that holds the root of our teeth. And the next process would be the palatine process. As I mentioned, the anterior 3/4 of the hard palate is made of palatine processes of the two maxillary bones. Then I quickly take a look at inside the orbit, simply because a significant portion of the floor of orbit is also made of maxillary bone. And here I can see that this section of the maxillary bone, the orbital plate of maxillary bone, articulates medially with ethmoid bone, lacrimal bone, and laterally it articulates with the zygomatic bone. And I see between the orbital plate of the maxillary bone and greater wing of the sphenoid bone, we have a very large opening that is called inferior orbital fissure. For example, the nerves, infraorbital nerves, pass through the inferior orbital fissure. Recall that infraorbital nerves are actually branches of the maxillary nerve of the trigeminal. When I continue and I get here, I see that I have another margin, which we refer to this as infraorbital margin. This one is made of both maxillary bone and zygomatic bone. About 10 millimeter below the infraorbital margin, I can locate this opening, which is called infraorbital foramen. Clearly, this is the place for infraorbital nerves to exit. And then below the infraorbital foramen, I locate this depression that is called canine fossa. To find canine fossa, we focus on the maxillary canine. We look at the root of the maxillary canine. When you get to the apex of the root of maxillary canine, superior and slightly posterior, or we can say superior and slightly lateral, we can locate the canine fossa. And exactly in the body of the maxillary bone, we can find maxillary sinuses. These are the largest paranasal sinuses that we have. The ducts of maxillary sinuses open into nasal cavity, again in middle nasal meatuses. So exactly in middle nasal meatuses, we also receive mucus from maxillary sinuses, and we also receive mucus from frontal sinuses. Recall that in the body of sphenoid, we do have sphenoidal sinuses. Sphenoidal sinuses, the mucus from them will be drained into the roof of the nasal cavities, exactly above the superior nasal conchae, and also in the lateral walls of ethmoid bone, we do have ethmoidal sinuses. Now from the two maxillary sinuses, I move toward midline to locate the intermaxillary suture. And as you can see right here, we have a very sharp edge that is called anterior nasal spine. Recall vomer is one of the facial bones that forms the lower part of the nasal septum. In the anterior view, when we look at the nasal septum, the lower part, inferior section, is vomer, facial bone. The superior part is perpendicular plate of ethmoid bone. On the lateral wall of the nasal cavities, we know that superior nasal conchae and middle nasal conchae are part of ethmoid. However, inferior nasal conchae are separate bones. They are facial bones. From maxillary bones, I start moving toward the lacrimal bones. We have two lacrimal bones. We're looking at the left lacrimal bone, exactly where frontal process of the maxillary bone forms suture with the lacrimal bone. We locate a depression that is called lacrimal fossa. As you can see, lacrimal fossa extend through both maxillary and lacrimal bone. And when we look deep inside the lacrimal fossa, we see that opening, which is the opening into the nasolacrimal duct. Recall that when we are inside the orbits, exactly in this depression, which is in frontal bone, we have lacrimal glands. Lacrimal glands secrete tear, or we can say lacrimal fluid. Tear, lacrimal fluid contains different components. They clean the surface of the eye and eventually go toward the lacrimal fossa. When lacrimal fluid gets inside lacrimal fossa, it basically, through this opening, gets inside the nasolacrimal duct. And when we follow the nasolacrimal duct, we see in inferior nasal meatuses, the grooves that we have below inferior nasal conchae, lacrimal fluid empties into the nasal cavities. Since I'm inside the orbit, it's important to note the round opening that I see at the end, that's optic canal. That's the pathway for optic nerve, which is the cranial nerve number 2. And between the lesser wing of sphenoid and the greater wing of sphenoid, I find superior orbital fissure. So inside the orbit, we have 2 fissures. Inferior orbital fissure is located between orbital plate of maxillary bone and greater wing of the sphenoid bone, but superior orbital fissure is located between lesser and greater wings of the sphenoid bone. Again, recall that superior orbital fissure is the pathway for many important structures, such as some of our cranial nerves. Cranial nerves number 3, oculomotor, number 4, trochlear, number 6, abducens, and also ophthalmic branches of trigeminal nerves pass through the superior orbital fissure. So whenever you are inside the orbit, look for optic foramen and superior and inferior orbital fissures. Now we are ready to talk about the zygomatic bone. As you see, part of the lateral wall of the orbit and a section of the floor forms by zygomatic bone. So we can say that the floor of the orbit is mostly made of the orbital plate of the maxillary bone and also the zygomatic bone. However, please note, this is not a real skull. If you have a real skull, in the floor of the orbit, somewhere here, we should find part of the palatine bone. So if I go back to the inferior view and show you the hard palate, we know that when we look at the posterior of the hard palate, horizontal plates of palatine bones form the posterior section of the hard palate. And when we look at the lateral wall of the nasal cavities, the vertical plate of palatine bones form a section of lateral wall. However, when we follow the vertical plates of palatine bone, we see that the most superior part of the vertical plates of palatine bones form a very small section in the floor of the orbit. Now going back to the zygomatic bone, in zygomatic bone we should identify 3 projections. This one is called frontal process of the zygomatic bone because it articulates with frontal bone. That would be the maxillary process of the zygomatic bone because it articulates with the maxillary bone in zygomaticomaxillary suture. And here we see this projection of the zygomatic bone that is called temporal process of the zygomatic bone. It articulates with the zygomatic process of the temporal bone. When we have the temporal process of the zygomatic and zygomatic process of temporal together, we name the entire structure zygomatic arch, which is the attachment site for some important muscles. And in this skull, because it's not real, unfortunately we don't see some important foramina that we should find in zygomatic bone. One of those foramina is supposed to be found on the external surface. We name that foramen zygomaticofacial foramen. And the other foramen should be found in the posterior view of the zygomatic bone. We call this one zygomaticotemporal foramen. These 2 pathways are pathways for nerves such as zygomaticofacial nerves and zygomaticotemporal nerves. Please recall that both these nerves are branches of zygomatic nerve, which is a branch of the maxillary nerve of the trigeminal nerve. Now I move posteriorly And I can see first the greater wing of the sphenoid bone. And then behind that, I see the temporal squama, the flat section of the temporal bone. Please note, in a real skull, temporal squama is extremely thin. Fracture of the temporal squama can easily place the life of that individual at risk because, as I mentioned, the bone is not really thick in this section. When we follow the zygomatic process of the temporal bone, when we get here, we see an elevation that is called articular tubercle or articular eminence. And behind articular eminence, we have a depression that is called mandibular fossa. Exactly, that's the place that we look for a layer of fibrocartilage. Again, we do not see the fibrocartilage in this skull, but we must have a layer of the strongest cartilage in our body, which is fibrous cartilage here, because that's the place that the condyle of mandible articulate with to form temporomandibular joint. So whenever we talk about temporomandibular joint, that's a joint that forms between three structures: the condyle of mandible and the mandibular fossa and articular eminence of the temporal bone. In a separate video, I talk about different movements that we have in temporomandibular joint, but the importance of having fibrous cartilage here is that even though this is a very small joint, but we move and use it a lot. For example, right now that I'm speaking, I experience movement in my temporomandibular joints. Please note, behind the mandibular fossa, we have external acoustic meatus. Blow to the mandible and pushing the condyle of the mandible backward can easily damage the external acoustic meatus. Below, I can see the styloid process, which is the attachment site of some very important muscles. And posterior to styloid process, I can locate the bulky process, which is called mastoid process. Some very important muscles are attached to mastoid process. And then when I go to the posterior, I can locate the mastoid foramen, which sits posterior to the mastoid process. So these are some important structures that we find in the lateral view of the temporal bone. And if I show you the inferior view, then we can also locate the stylomastoid foramen, which sits between styloid process and mastoid process. That's the exit for the facial nerve, cranial nerve number 7. Now, it's good to go through the external view of mandible. Please keep in mind, mandible is the only bone in our skull that we can move. The lower part of the mandible is called body of the mandible. So let me show you a better view of the body from anterior. That's the body of the mandible. And the two projections that go up, we call them rami of the mandible. Exactly in this part of the mandible, I can locate mental protuberance. Then I can locate the mental foramen. Obviously, mental foramen is the pathway for mental nerve, which would be one of the branches of the mandibular nerves of the trigeminal. Then I locate the alveolar process of the mandible, which has the alveolar sockets to hold the roots of our mandibular teeth. And when I move laterally, exactly where ramus meets body, I can locate the mandibular angle. From mandibular angle, I move superiorly. The two projections that we have on top of ramus, the posterior one is the condyle of mandible, or we can say mandibular condyle. The anterior projection is coronoid process. As you can see, coronoid process does not articulate with any other bone. However, that's the attachment site of some important muscles. For example, one of our muscles of mastication, which is temporalis, it's a very large muscle. Its tendon is attached to the coronoid process, and that's one of the muscles that when it contracts, it pulls coronoid process up. Basically, it elevates mandible and help us to close our mouth. Between coronoid process and condylar process, we have the mandibular notch. exactly the end of the condyle is considered the head of the condyle. So that's the part of the mandibular condyle that actually forms temporomandibular joints with mandibular fossa and articular eminence of the temporal bone. The narrow section of the condyle is considered the neck of the condyle. And when I look at the anterior view, I can see there is a depression in front of the mandibular condyle. We call that pterygoid fovea. And when from coronoid process I move down, I see this sharp edge that is called oblique line. So these are some of the important structures of the mandible that we see in anterior view and lateral view. Now I quickly go to the posterior view. In the posterior view, I locate the occipital bone. We know that occipital bone forms a suture that is called lambdoid suture with the two parietal bones. And please recall that the suture that we have between temporal bone and parietal bones would be considered squamous suture. In the middle of occipital bone, we can easily palpate external occipital protuberance. The line at the same level with the external protuberance is superior nuchal line, and the line below would be inferior nuchal line. Some important muscles are attached to the nuchal lines. I can see the foramen magnum, and lateral to foramen magnum, I can locate the two occipital condyles, which we know these two articulate with atlas, which is the cervical vertebral bone number 1. And together, occipital condyles and atlas form atlanto-occipital joints. That would be the joint that allow our head to move up and down. So, going back, since I show you this view, it is good to note that when from the occipital condyles I move laterally, as soon as I get inside the temporal bone, I can see the styloid process. Lateral, I can see mastoid process, so I should be able to identify those structures no matter what the view is. And then inside the body of the mandible, I locate the mylohyoid line, because that helps me to differentiate the two depressions that we have here. One is above mylohyoid line. We call this sublingual fossa. That's the place that we look for sublingual salivary gland. And the other depression is below mylohyoid line. We name this submandibular fossa. This is the place that we look for submandibular salivary gland. And exactly this spot is the place that we find some pointy projections that they have different names. One name that we use to refer to them would be the genial spines. Inside the ramus, we locate this important opening that is called mandibular foramen. It's somehow protected by this projection that is called lingula. And mandibular foramen is the pathway for a very important nerve named inferior alveolar nerve, which would be one of the branches of mandibular nerves of trigeminal, to enter the mandible. Clearly, that would be the nerve that, for example, supplies the pulp tissue of the lower teeth. So this was a very short summary of some of the important structures that we find in the external view of the skull. I hope you find this helpful.